pandemic, testing in humans has been a complicated matter. What may come as a surprise is that testing in wastewater has been consistent and very valuable to communities around the world. Groundbreaking research in that space has taken place here at the River Mountains Water Treatment Facility, where our scientists have been at the forefront of protecting our water supply, both here and around the world. Public safety has always been the Las Vegas Valley Water District's greatest priority, ensuring safe water is delivered to your tap. We analyze water samples more than 300,000 times each year, but also dedicate a large number of resources to what has yet to be discovered.
The Research and Development Division has been in existence for approximately 20 years. And what we try to do in that division is stay ahead of the curve in terms of new contaminants and new issues in the field.
Over the last 2 years, scientists from our partner agency, the Southern Nevada Water Authority, have emphasized R&D in microbiology. That research produced results during the start of the pandemic, detecting the genetic trace signature of COVID-19 in wastewater almost immediately.
We actually found it on the exact same day that the first 2 cases were confirmed here in Southern Nevada. So it's a great early warning signal for that genetic signal of the virus in the community and an indication that COVID-19 is in that community.
Now let's be clear, it's wastewater coming in that shows trace signatures of the virus, but that material is removed or killed in the wastewater treatment process, ensuring that our drinking water supply is safe.
We do not detect it in the back end of the wastewater treatment plant. So basically, we're convinced that the wastewater process by itself is eliminating that organism. We are not detecting it in our raw water, and we are certainly not detecting it in our finished water.
We want to make sure that we're adequately protecting public health. So by showing that signal gets knocked out early in the wastewater treatment plant, even before it impacts our drinking water source, that's a great indication that this is not a risk on the drinking water side.
So in terms of the transmission of the COVID by a water route, it's not there.
What is there, however, is progress in the area of wastewater epidemiology, using water to track the prevalence of an outbreak in a community. The SNWA has shared its information to assist the water industry and public health organizations around the world. SNWA scientist Dan Garrity even participating in a briefing before congressional staff.
It's another piece to that puzzle to try to figure out what's happening and what's the best approach to try to mitigate the impacts of that disease in the community.
Going forward, as the disease starts to drop in our community, that genetic signal will start to drop in the wastewater as well. If the signal increases, that will provide an early warning to the community that cases are on the rise.